When I started to work with her, it was a lot about finding safety first around me in my environment, and then from moving outside, slowly start moving in towards finding safety within myself. I was bedbound, and then after a week, I was actually capable of doing a lot of things like small activities. I started to get my life back in many ways.
Hey guys, there are so many ways chronic conditions like ME/CFS and long COVID can begin. But the thing that these journeys have in common is that when they start, it feels like your body yanked the emergency brake and then forgot to tell you why, and then threw the repair manual out the window. If this sounds familiar, you are going to love today's guest and what she has to share with you. She doesn't just bring hope. In her story, you will hear her explain pretty much every key action you need to take when facing many chronic health conditions. Hi there, I'm Raelan Agle. If you've been with me for a long time, thanks for joining me once again. If you're new here, welcome. This is where we dive deep into real recovery stories from chronic health conditions. No fluff, no censorship. If it worked, we're talking about it because every journey teaches us something. Today, I am thrilled to introduce you to Julianne, joining us from Copenhagen, Denmark. After a head injury turned her world upside down, she spent over 2 years navigating scary symptoms. What started as exhaustion and a lot of uncertainty devolved into 6 months of being completely bedbound, having to wear an eye mask and ask her parents to stop visiting because she couldn't tolerate light or sound. But this was the start of an incredible journey for Julianne of piecing herself and her life back together. And she is here bravely sharing her story to support others who are also trying to find their way forward. She's going to share what helped, what didn't, and why recovery isn't a straight line, but it's always possible. So let's dive in. Julianne, so incredible to be here today. I'm really excited to hear about this journey that you've been on. So thank you for doing this.
Thank you for letting me come here. I'm very excited.
Yeah, I really appreciate you putting yourself out there and sharing your story because I know it's not always the easiest thing to do. So, how did this all start for you?
Well, it started, so now I think it was in 2022, and it started during summertime. I was just like living my life, partying, having a good time, and I was at a birthday party, and I had a friend who lifted me up just to say hi. Was very excited and a bit drunk, and then I hit my head in a pavilion. And what happened was that I, after that situation, got a concussion. And that was basically where it all started. For me in the beginning, I didn't know anything in general about a concussion, anything. And so I was not really aware of the situation I was in. And yeah, I was just kind of just keeping on going with my life. And after a while, I started feeling more intense headaches, and the symptoms started getting worse. So it was there I could like feel that there was definitely something more serious going on. And yeah, that was actually where the whole story started. It started with post concussion symptoms. And that's also a long story, but I mean, I worked with dealing with my symptoms for a long time, trying to figure out what was wrong. And the thing was that I was only in the beginning looking at the specific situation that was concussion. So if I had any injuries, if there was, yeah, only around that. And I mean, I was looking for solutions everywhere. I went to doctors, had brain scans, all different things. And there was nothing really wrong when they look at it, which is mostly the case with concussions as well. And what I slowly started figuring out was that over time, these symptoms gotten worse and worse. And maybe after a year, they really were peaking. And I had like a peak moment where the symptoms just, I mean, I was, not able to do anything. I was starting to isolate. And obviously, that also affected my mental health a lot. So I started getting a lot of anxiety, depression, and yeah, basically just lost everything around me. So I was just in the end bedbound, as a lot of other people I've heard about, especially on your channel as well. So I had some very difficult months where I was not capable of anything. And that was quite crazy because normally it's a bit like where it all starts with being in a very difficult situation where you are not capable of doing anything and then you start getting better. But for me, it was kind of the opposite, which was very scary at that point because I didn't know what was happening. So that was what you say, like the peak point of the situation, and also probably the turning point where I was, yeah, not even capable of finding any help or anything. So my family started to figure that out. And I mean, that was the turning point was where I met a physio who worked with people with chronic pain and PTSD. So a lot with actually what she did was she was a physio, but she also was a trauma therapist, which was quite interesting because suddenly it became way more like it was much more far away from the concussion itself. And when I started talking with her, she was like, I actually don't think you have any concussion anymore. I actually think it's much more about your nervous system, which is also a big factor in all of this. And that was kind of a very different situation because it was like when I started talking with her and working with her, it was a completely different experience for me compared to all of the other help in general I tried to get from people and professionals. So that was pretty crazy to suddenly go from thinking I had a concussion and that I was scared that it was actually like a brain injury or something like that. And then suddenly it was all about my nervous system. And that was also why I thought it was really relevant on your channel because it's a bit of a different story than a lot of the other people who has been on the channel because it's actually starting with something else, but in the end it's still the same situation or the same kind of progress process I've been through. Yeah, so I mean overall in general that is where it all kind of turned for me when I started working with my nervous system. And I mean, the main thing for me was trying to find safety because I was not capable of even like working with my mind at that point because I was in this freeze state for a long time. And that was, a feeling of hopelessness and also helplessness. Like I was not capable. I was almost like a baby who was not capable of doing anything. Yeah, so that was crazy to start experiencing this sense of safety again because in the end that was all about what my body was reacting to was this feeling of being unsafe in my own body. And when I started to work with her, it was a lot about finding safety first around me in my environment, and then from moving outside, slowly start moving in towards finding safety within myself. So that was really a crazy time to feel like no one understood me for a year, and I didn't even understood what was happening myself. And then from I think I was bedbound, and then after a week I was actually capable of doing a lot of things like small activities. But it was a huge difference for me because I started to get my life back in many ways. And yeah, that was really crazy.
I have so many questions. You did such a great job of summing up such a long, intense, which had to be a nightmare of an experience for you. And I know it's tough to just like, how do I sum this up? What are the key points to share? I appreciate you sharing your story just for people listening, because if you're one of them, I've had so many people reach out to me saying, mine started, I had a head injury or I have a brain injury. Like, is there any hope for me? Does this apply to me? And I really have trouble thinking. Like, you guys talk about brain retraining exercises. I don't think I can do them. I don't have the focus. So one, just so grateful that you're here talking about this because there are a lot of people going through it that are going to be very grateful to hear your story. And I'm always curious to hear about these times that you spent when you were bedbound, because so many people get stuck there. And how did you even just get yourself through those really long days. Like, what were you thinking and what kept you going?
Yeah, so I mean, for me, it was some really, really long days and a really dark period, I would say. And I think, to be honest, in that period, what was keeping me up was connections, like just having people I loved and around me in that period. And also, for me, I had a period where I almost lost hope around if I would recover or even start getting better. And I think for me in that period was also asking for help and acknowledging that I was not capable of doing everything myself. So I think that was all about maybe surrendering a bit to my situation. And I think, yeah, for me, it was probably also when I was like, okay, I really need people around me. I need help and I need people to take these actions for me because I was not capable of doing it. So that was like the period where it was like really, really tough. And I think also what got me through it was really small things in general. Like I remember I tried to use because obviously because I was afraid of my brain, I was not even using my phone or anything. I was just like in silence. And actually I was also wearing a sleep what's it called? I can't remember, but I
Like
was
an eye sleep mask.
yeah, I sleep mask. So I was completely in like a dark room, completely silent for maybe 2 months almost, not completely. But what I did was that it was all about survival in that period, to be honest.
Oh,
And I mean, what kept me going was definitely that hope of I still had a bit of hope around like someone or something will change it at some point. And for me, that was also, yeah, I mean, I think just people around me, to be honest, in just
yeah.
that period was all I needed because that was super scary when you feel like you can't even help yourself. I guess there's a lot of other people who is in that situation. And for me, I had a really good family who was very supportive. So I hope for everyone else that you have someone that is in like, I mean, I also have my cat actually was also a big part of it, which I think is also a big difference if you don't have like people around you. I had my cat who, because there was like a short period where I was not capable of even like being around my parents because it was just too much. Like they were talking to me. And that was also where my pet actually was a big sense of safety without me knowing that. And I remember also, I was almost like a child in my mind. And I remember I also found I had some old things from when I was a child, which was quite interesting. But I had like an old teddy bear I haven't seen since I was very little in my parents' house. And I remember like very unconsciously I was kind of searching towards safety in many ways. So that would also be like having something near me, like yeah, a teddy bear or my cat, or in general just like being very comfortable, which was something I can look back to now and see that that was probably something that helped me a lot without me knowing it in that period. And
I
then
interviewed a health coach who talked about how she gets all of her clients to get a teddy bear. And she said most of
yeah,
them think it sounds really silly. But as we hear in so many of these interviews, it's, of course, the teddy bear isn't the answer for everything, but it's a series of small things that can comfort you and put your nervous system in a more relaxed state. So it's time and time again, I hear it's not dismissing these small things and it's going to be an accumulation of small things.
mm, yeah, and
Yeah, that helped.
also I remember another thing was especially I did a lot of visualization as well, I remember, where I was visualizing myself somewhere. I remember I was visualizing myself surrounded by my best friends. I was, all of this, you also, which I know about now, science based is a big tool for pain relief and in general also a sense of safety. But I remember it was more of like something I just really wanted. And because I felt like I lost a part of my life at that point, I started visualizing things. And that was really, I think that was also a big thing that got me through that period because I had these small moments of joy. And that's something I still use today, I would say, if I'm in situations where I need it's very helpful. So yeah, being surrounded by my friends, just using my senses in different ways to calm myself, that was a really helpful tool as well in that period, because it was really like the simple, small things I was capable of.
Yeah.
Yeah.
So you said you started working with that physio who was talking to you about your nervous system, and having feelings of safety slowly allowed you to be able to start doing more. So what did that look like? Were there exercise, like mental exercises you did, or how did you start bringing in that feeling of safety to work with your nervous system?
Yeah, so coming back to the teddy bear, it's just an example because I think you can use it many different ways. But what she started doing was, which funny enough, was that she asked me if I had any object from my childhood, because she in general also worked with trauma, past trauma experiences. And then I immediately thought about this teddy bear because I just found it somewhere in the room. And the first thing I remember we started working with was like going back to some periods in my life where I could remember like sitting with it. And what I was trying to do was again visualizations where I was imagining myself as a small child with this teddy bear and all of the sensations, the sounds, touch, all of the different senses was like a way to then start sensing my body, how that changed within. So it was a lot about working with my sensations in my body and start to work with them in a different way. And that also made me realize that I was only up in my mind in that period. And I was very closed off to sense my whole body. I was, yeah, in this freeze state for a long time. So she did some different kind of brain training exercises with me as well. I needed to repeat every morning when I woke up. I was repeating, like, I'm sore, but I'm safe. All of these different tools that I've also been seeing on your channel as well. So I've actually also used some of the brain training tools you had on your YouTube channel, which was super helpful for me in the beginning, actually.
Hey guys, a quick interruption. So, just so you know, 99% of the recovery information that I share is available for free online in various formats. I send out weekly emails, I post regularly on Instagram, and I have hundreds of videos here on this channel, all packed with valuable insights. It's accessible to everyone. However, if you'd prefer to save yourself some digging, you might be interested in my online course, Brain Retraining 101 for ME/CFS and Long COVID Recovery. It delivers everything that you need to know in bite-sized pieces so you can spend just a few minutes each day gaining tools to propel you forward on your journey. The course is self-paced, so no pressure, and includes online support spaces, including group coaching calls with myself and with other coaches. You will learn the brain science behind recovery and gain the best tools for brain retraining and nervous system regulation, all while receiving support from our incredible community. Oh my goodness, you're going to love them. They are there, they truly get it, and every week they are cheering you on. If you are ready to supercharge your recovery, you can check out the link in this video's description to join or to learn more. And I look forward to meeting you in one of our live group coaching calls.
So that was something where I then started doing small activities. So the first activity I started doing was something that gave me some kind of value. So instead of thinking like, okay, I need to be able to make breakfast for myself, for example, the first thing I was more focusing on was, okay, but what do I feel like doing right now? What gives me some kind of joy and value? And what I was thinking of in the beginning was like, I just want to make myself a nice cup of tea because there was like some kind of a comforting feeling and where you're kind of taking care of yourself in some kind of way. And I remember that was where I started slowly begin to be able to do more small, simple activities. And that was where I was reminding myself all the time that it was okay to get a bit of symptoms. Actually, I needed the symptoms to also see that the reaction I had when the symptoms increased was actually what was causing the problem for me. So that was where it all started, that I needed to see, okay, it's okay. I don't need to try to let the symptoms go away or panic when they comes. It's all about how I react when they arise. And that was where I started to, to just get my life back, actually. And it was also to see that my fear around activities was a big thing. Like, I thought that doing this specific activity is what causes me pain. And that was what was triggering or creating this circle around that. At some point I was not able to do any activities because there was just a feeding cycle, anxiety cycle. So that was how it all started, and then I slowly start moving forward, trying new things, and also trying to see it more as a challenge in some ways, where I could give myself some success stories. Yeah, and that was a really, really crazy time, because there was just this feeling of completely joy, like even being able to make my own cup of tea. I was like ecstatic. Yeah, and that was really a crazy turning point for me, and especially because it happened within a week, and was bedbound for, I mean, that was almost a half year, 6 months, where I was really not capable of doing anything. So
Wow.
yeah.
It never, no matter how many times I hear it, it never ceases to amaze me how quickly people can start to see progress. I mean, overall, the journey still takes some time, but when you're in such a severe state, you can feel like there's nothing that's going to make a difference in a week, or, a short amount of time. But yeah, it's really impressive. And also, just as I'm listening to you, I'm very impressed by you, Julianne, because you've touched on pretty much all of the core components that every expert I interview talks about, saying what you need to do. And you just seem to learn them very quickly and embrace them and accept it and put them into practice. Those things about not reacting to symptoms and, the messages of fear, and realizing that you need to have some symptoms. There are actually opportunities to work on them, and just so many other things. So, yeah, was it initially challenging for you to embrace that? Because this isn't what we're taught as children or adults growing up, how you face serious symptoms. So,
It was very difficult in the beginning. I would say that was also why I was starting really, really slowly. And I think there's different ways to cope with it. And for me, it was like I was not in a rush. I was just like, okay, I don't know. I really don't matter right now how long this is gonna take for me to recover. For me, it's more important that I kind of have myself with in it. And so because I felt like I was losing myself for a long time, so this feeling of slowly getting my life back was something I really didn't want it to end, or that it would happen again. So I feel like that period was difficult in many ways, but I also feel like I managed to try at least to be patient and think about that I didn't need it to be in a rush to feel better. And it was more important to, what I feel like was that it was more important to enjoy my days and get most out of the days, compared to looking forward, which I know is not something I did every day. It's easier said than done, but I feel like that was what I was working towards a lot, which is leading me to my next very important thing. I know I have so many things I want to share. So but working a lot with mindfulness, which I practice a lot when I was able to start doing some meditations, and in general trying to be in the present moment instead of thinking about how am I feeling in a few hours? Am I feeling worse or better? So a big thing was to start, like when I was making the cup of tea, being aware of doing it, enjoying the situation, and then not try to think so much about how I was feeling before or after doing it, but more like doing it because I enjoyed doing it, which was also super difficult, and it took a long time, but it got better and better over time. And I would say so, and obviously it was also with a lot of also had a lot of setbacks or situations where I got overwhelmed. Everything felt too much, but then I always learned something when I was in those situations. Like then there was, I felt, if I felt stuck in a situation, that was also where I kind of figured out, okay, this is not working. What I'm doing now, maybe it's something else, or maybe I needed to widen my perspective in that situation. So, yeah.
Yeah, that's a massive one. So it sounds like this journey, there was a lot of learning and a lot of different things that helped to get you to where you are now. So what else stands out to you that you'd like to share?
Yeah, I think what I want to share is that for me, what was probably some of the biggest learnings was that I so badly wanted to, again, working with doing everything perfectly to recover. Also, something I can see is a common thing is this like personality about that you want to do everything perfectly. And for me, that was also a lot about my mind wanted to fix things. And for a long time, even though I was starting to recover, I still have this like underlying feeling of I wanted to fix it. I wanted still the symptoms to go away. And that was my main intention of doing things. And after a while, I realized that it was not so much about fixing or doing things to make the symptoms go away. It was much more about, as I said, as I mentioned, how I reacted when the symptoms arise, and also how I could live a life even though I had symptoms, and actually realizing that I could have a really nice life even though the symptoms were there or not, and starting to learn that that was all about acceptance of the symptoms, which was it took me a while to understand what the meaning of acceptance, because I heard it a lot from people like it's all about that you need to accept the situation you're in, and I was like, I want to accept it, but I don't know how. What I over time figured out was that it was a lot about surrendering or just allowing things to be as they are, and work with that in a compassion way or like a comforting way where I was not trying to make myself different than I was. So it was a lot of emotion work, a lot of suddenly it was a lot of lifestyle, how I was wanted to live my life, what was important, and a big life change, I would say, to just look at what my life was before and what kind of life I wanted to live now, and not because I had symptoms. So, trying to live a life as I was, completely symptom free. Yeah. And that changed everything for me, I would say.
So it was no longer the goal to get back to where you were, the life that you were living. It was just thinking about every day, how do I want to live today? What brings me joy? And sort of reevaluating the way you approach things, just generally, it sounds like.
Yes, exactly. Yeah, it was a lot of really big questions I feel like to get in a young age. But I'm very grateful for it now, because it has been taking me in a really good direction in life. And as you said, it was more about maybe also realizing that in general, what led to me having chronic pain and just stress related symptoms as well was also the life I had lived before the concussion happened. So it was like going back memory lane towards all kinds of things in my life and realizing that maybe that was not the life for me now. Maybe I should live it a bit differently and see how that works. So, and especially like trying to live in this more day by day thing. Not obviously you can have dreams and goals, but also like not being hyper focused on a specific fixed point, and then that's all that matters. More like
Yeah.
widen your perspective, widen my perspective.
So you talked about being able to get up and make a cup of tea, and that is a dramatic change from being bedbound and unable to move. But now you're clearly much further along now. You're back to living life. So, how did you get from there to here? How did you start doing more movement and things?
Yeah, so like a big or like a tool in the beginning was also starting to move my body more. I mean, obviously, it's also a big difference from being very active as I was before and then being bedbound for a long, long time. And what I also realized was there were so many different ways to get more into my body and out of my mind, out of my head all the time. And what helped me a lot in those situations was different kind of movements. And what I started with was gentle stretching, yoga, and that was actually a really, really big thing that has changed a lot. That was one of the ways I could see a huge difference on my recovery, was that I was more capable of moving my body, getting stronger again, gaining more confidence and trust in myself. And that all started with yoga, because I was capable of still being present while moving, and that was very powerful for me when I was having a lot of anxiety and fear around activities, especially. So what I did was a lot of somatic yoga, where you work with mind body connection, and yeah, that led me to going further and further with the movement. And now I'm also teaching yoga myself, doing mindfulness. That's also where I am today, which is my dream now, is to help others. And I think that is a really, really great way, because I struggled a lot with working with my mind. And for some people, it can feel overwhelming. So that is a really, really nice way of also getting into recovery, working with your body and the signals your body is giving you, starting to trust your body's signals, get to know it in different ways. Yeah, that was very helpful for me.
Amazing. Yeah. And for people listening, if you want to see more about what Julianne is up to, we'll put her Instagram up on the screen here and also in the description. So definitely check that out. So what is life like for you now that you have come through this?
Yeah, so I mean, I think in many ways very different than it was before, but also I feel way more present, to be honest, like almost like it's a new chance of living for me. And I think I'm doing everything which with much more awareness and joy. Like I really appreciate life in another way than I did before. And what I do is I've been traveling a lot lately, experiencing different cultures and learning a lot more. I think it's a really, really, in general, interesting topic. And it's also, I think, like a lot of others, really fascinating me to start learning more about, and maybe also being able to help and share with others in the future. So my way of moving into that was by movement and yoga, mindfulness, and weaving that into my knowledge around the nervous system, and yeah, how much capable you are, or your body is, of healing itself without you actually needing to do anything. Yeah, so I feel like I'm a really good place in life, and I'm very open to everything. So that's really amazing.
So for people who are listening that are still in that really challenging place where they've got all of those symptoms, and it can feel sometimes like it's never going to change and you're going to live this way for the rest of your life, would you have any advice, or what would you say to people that are still in that place?
Yeah, I think what was a word that have been with me from the beginning is trust, working with trusting your own body's capacity to heal itself. And yeah, just the knowledge and knowledge around that your body is actually capable of healing, and that you are not broken. I think that's very, very important. And in general, just not just, but stay curious about searching for opportunities to help, because I'm sure you will find it. And yeah, in general, recovery stories, that was also a big part of my, yeah, where I got a lot of hope from. So yeah.
Yeah. I love that you said hope, but you also said trust. And because I'm sort of guilty of using the word hope a lot, but hope can imply a sort of a wish, or like you hope you win the lottery. But whereas what's even more valuable is hanging on to feelings of belief and trust in the process. So I really love that you explained that. Thank you so much for sharing your story. I have no doubt tons of people are Very grateful to hear this. I'll link on the screen the playlist to all recovery stories on the channel. So people definitely check it out and, find something that resonates for you and bookmark the ones that really mean the most to you so you can watch them on your challenging days. Julianne, thank you. Thank you. I'm so glad that you got through this. And now, I appreciate you sharing your story.
Thank you so much for allowing me to be here.
Oh, absolutely my pleasure. Thank you to those of you watching and listening. And I hope to see you in one of these next videos in this recovery playlist.